Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here we're going to talk about phenazopyridine, the common urinary pain reliever, phenazopyridine. As with all my videos, informational purposes only. So what is phenazopyridine? In the U.S., it's sold under the brand name AZO. In Urostat, over the counter. Prescription is sold under the brand name Pyridium. It's a urinary analgesic. That means it helps with pain in the kidney and bladder, basically the urinary tract. It helps relieve some of that pain, the burning, the urgency and frequency and discomfort in the urinary tract caused by infection, trauma, surgery, procedures, catheters, or other irritations of the urinary tract. Dosage, pretty simple. The prescription is generally, I mean, your provider, your healthcare provider will determine the appropriate dose, but generally 200 milligrams 3 times a day, often in conjunction with an antibiotic if there is an infection occurring. So if you have a urinary tract infection, a lot of times you'll use Pyridium or Phenazopyridine for the first couple of days while the antibiotic gets the infection under control. And we want to take that after meals. The OTC version, the tablets are 99.5 milligrams. You really want to be careful in the OTC section as AZO. There are many different AZO products available. You want to check the active ingredient, AZO, Urostat. There are many products available, and if you're wanting the pain relief, be sure to check for the active ingredient. But the OTC is generally labeled for 2 tablets 3 times a day, no more than 2 days, with or right after a meal. Some of the warnings, cautions. Generally, this medicine tolerated really well, so not a lot of problems for most people. However, if you have poor kidney function, you'd want to talk to your provider before you used it. It will discolor the urine. It will be noticeably red or orange. That can alarm people if they're not expecting that. It does not treat infection. It simply treats pain. So if there's an underlying infection, you'd want to seek medical attention. Do not use if you have a G6PD deficiency. Now, if you have that, you'd probably know that's a glucose 6 phosphate dehydrogenase deficiency. It's not very common. So if you had that, you would probably be aware of it, and you'd want to talk to your doctor before using this medication. It will stain clothing, and it can stain, it's been reported to stain contact lenses as well, and it may interfere with lab urine tests. So if you're needing your urine tested for something, you would want to talk to your healthcare provider before using phenazopyridine. Side effects, really generally mild. Sometimes people report headache, rash, itchiness, or a stomach upset. It is extremely rare, but the literature did have a report of severe allergic reaction, but again, very, very rare. I appreciate you watching. Please like this video and subscribe to my channel.